All right. Good morning, everyone, on this cold morning. Well, at least in Chicago it is, I can say. We're excited that you're joining us for the second training in our 12-part Mainstream Benefits series. The topic of this training will be Medicaid eligibility in a post-pandemic world. My name is Beth Warner. I'm a paralegal with the Public Benefits Practice Group at Legal Aid Chicago. I have lived experience with homelessness and human trafficking in the city of Chicago. And the work I currently do is outreach with folks who are currently experiencing homelessness. Just a couple of quick thank yous. David Esposito at SHIPA, the Supportive Housing Providers Association. Thank you so much for providing this opportunity. David's going to give us a bit more of a substantial introduction to what's going on at the end of this training. And of course, thank you to the Illinois Office to Prevent and End Homelessness for providing funding for this training series. Okay, couple of housekeeping things. This is going to be around a 50-minute, probably slightly shorter presentation. We want to leave time at the end so that folks can ask questions. We're going to ask that we hold those questions until the end. If you can see up in the top bar of your team's kind of screen here, there's an option that says Q&A. If you could post your questions up there, I'll screen them and we'll ask them at the end so that we're able to just run through this presentation straight through. There's going to be a link to PowerPoints will be sent at the end of the chat. We will discuss how we are going to be hosting the videos at the end of this training. Cameras are on, but microphones will not be on until perhaps at the end when we're asking questions. And then again, please feel free if there's something we don't cover or you still have questions about afterwards, please feel free to reach out to us for guidance and sort of assistance with those questions. So without further ado, it is my great pleasure to introduce to you Gwen Kaiser-Michon, who will be presenting this training on Medicaid eligibility in a post-pandemic world. That medical eligibility part of the sentence is catching on my lips this morning. All right, so Gwen Michon earned her undergraduate degree from Grinnell College and her law degree cum laude from Chicago Kent College of Law. She has been fighting to increase access to public benefits for the clients and communities she serves for over 12 years. Though originally from Chicago, she started her legal career at Southeast Louisiana Legal Services, where she represented individuals who are or recently were chronically homeless in New Orleans and Baton Rouge. In addition to helping her clients obtain the public benefits they need to survive, she advocated and still does advocate for systemic solutions to end homelessness, hunger, and to ensure low-income people can access vital medical care. Since June 2020, she has served as a supervisory attorney in Legal Aid Chicago's Public Benefits Practice Group, where she manages the PBOE, that's the Public Benefits Outreach and Enrollment Project. She also launched and now chairs the agency's Homeless Services Task Force at Legal Aid Chicago. She has represented clients in administrative proceedings and in both state and federal courts. Last year, the project she supervises obtained benefits valued at over $4 million for its clients. Over to you, Gwen.
Hey, thanks, Beth. So I'm just going to launch right in the interest of time. So thanks everybody for coming, and thanks everyone who joined us last month. Also for coming back. All right. Let me make sure I'm doing this right. All right. Beth, can you nod if you can see my screen? Because I can see your face. Okay, great.
I can see your screen.
Okay, great. Okay. So first, a little bit about Legal Aid Chicago. We are the largest nonprofit legal aid provider in the state. We serve primarily Chicago and the Cook County area, though some of our programs reach into other parts of the state. As you can see, we provide comprehensive legal aid services to low-income people, though my background, as Beth mentioned, is almost exclusively in the world of public benefits. So my goal today is to help you be more well prepared to help your clients overcome barriers to Medicaid access. And I hope you can answer the following questions. What changes are happening to Medicaid this year? Those changes started earlier this year and are actually continuing into next year. And then how can you help yourself or clients who you're working with overcome common problems related to the end of the pandemic and just access to healthcare generally? So since the burning question is what are these changes, I just thought I'd start off with that. So Medicaid is a state, as a joint federal and state program. So that means there are laws that come from the federal government and there are laws that come from the state. During the pandemic, the federal government changed a lot of the rules that affect how Illinois is allowed to provide Medicaid services. And as the pandemic protections were winding down, Illinois had to mostly revert back to the pre-pandemic rules. So that's really what's happening right now is we're reverting back to what we were before the pandemic. But there are a lot of people who have gotten onto Medicaid and a lot of people who have started working in this field during the pandemic. And so we know you might not know what the difference is between the pre-pandemic rules and now. So that's hopefully helping you understand today. So the biggest change that happened is that Medicaid redeterminations were paused during the pandemic. That meant during the pandemic, if someone got on Medicaid, Illinois was supposed to keep them on Medicaid unless the person wanted to be off Medicaid or if they died. And so that has ended. And so now we're reverting back to the rule that every 12 months, a person's eligibility for Medicaid, once they're on, has to be redetermined. That in most situations requires the person to do something, which they may or may not understand that they have to do something or what it is that they have to do. And so we're concerned about people losing coverage now that they have to do these annual redeterminations. Fortunately, some people will not have to do redeterminations quickly or at all, or at least they won't have to do anything proactive themselves. So 30 to 40% of Medicaid recipients are now having their benefits renewed ex parte, which is just a word that means basically that they don't have to do anything. The department is reviewing electronic records. They have access to certain information about the people who are receiving Medicaid benefits. So for example, they can see if someone's receiving Social Security benefits and how much that is. They can know if someone's getting Medicare benefits. They can see if they're earning income because they get records from IDES. And so if someone is receiving Medicaid currently and DHS or DHFS can tell through the electronic systems that someone is still eligible and that their situation is still basically the same as when they first got on, then the department should be renewing those people's benefits automatically. For everyone else, they're going to get a notice in the mail saying that they have to submit a redetermination. I'm going to get into more of that later. The renewal dates, fortunately, I think for the states were given options for how they do this redeterminations resuming business. Some states opted to have everyone get redetermined at the same time, which had the benefit of clarity, but also meant that a whole lot of people were losing Medicaid benefits all at the same time, which isn't great. Illinois decided to keep people on Medicaid benefits and do the redeterminations at the point when they would normally do their redetermination. So whatever the date is that whatever the month is when they started getting benefits, it'll be that same month of the year that they will have to do the redetermination. That means 1/12 of the people are having to do redeterminations each month. And so, which is great because more people can stay on Medicaid longer, but it also is confusing for folks because they don't know when their redeterminations are due. I'll tell you later how to figure it out. So that's the big change. A very exciting change that happened is that there is a resource limit for some Medicaid recipients. It's just for this age blind and disabled group, though. The other groups don't have a resource limit. I don't know what that means later. But the resource limit used to be extremely low, and Illinois has raised it to $17,500. And so, again, we'll get into that later, but I wanted to put these changes up front so that you could have them in your head. All right. So what is Illinois Medicaid? While most people think of Medicaid as a single program, which provides access to medical treatment and prescription drug coverage for low-income people, it is actually a large range of programs. And this is part of what leads to confusion about the Medicaid program. So in this chart here, you can see the Illinois Medicaid program. I created this framework. This is not an official framework, but this is how I think about it. I think about it in 5 kind of pockets. One is this age, blind, and disabled group. For those of you who have been around pre-Affordable Care Act, like me, that is like traditional Medicaid. That one has existed for a very long time. It's for people who are over 65 years old and for people receiving Social Security benefits. The second group is what I've grouped here as MAGI. That word means nothing to most of you. It means modified adjusted gross income. Also not very helpful for you. We'll get into why that term is used in a little bit. But that applies to adults who do not fit into any of the other categories. That's the group that got Medicaid benefits through Medicaid expansion that happened under Obamacare or the Affordable Care Act. It also applies to children up to the age of 19 and to pregnant women up to 12 months after the birth of their child. The third pocket is for certain immigrants. We'll get into the details of that later too. And then there's these other categories that I put kind of broadly here, where there's partial Medicaid and long-term care coverage. Those are very specialized groups. I wasn't going to cover them today. If anyone's interested in getting more training on those, please let us know. And we will develop something in the future. But I did want you to know that they exist. So they're on the chart here. You can pay attention to the colors here. I'm going to use the colors as we go through. So the first group is this aged, blind, and disabled group. So like I said, this is for people who are receiving Social Security benefits. It also could be folks who are receiving railroad benefits, which uses the same disability standard and retirement standard of Social Security. So people who are getting those benefits based on blindness or disability. It is also for people who are denied Social Security benefits based on income, but otherwise meet Social Security's definition for blindness or disability, or anyone over 65. So aged, blind, and disabled. There are citizenship and immigration requirements for this program. So primarily U.S. citizens and people who have obtained refugee or asylee status. So not folks who are in the application process, but they've got the status secured. Legal permanent residents and people who are trying to obtain immigration status under the VAWA rules, that's Violence Against Women Act. They can qualify for age, blind, and disabled benefits, but there's a 5-year waiting period before they become eligible. And then certain other immigrants, and there's a long list, it's very detailed. So I put a site here in case you want to look it up. As we go through these, I'm going to describe the household compositions that DHS uses when determining how to apply these income limits, because it's different under the age, blind, and disabled rules than it is under some of the other categories. So for the age, blind, and disabled, we're looking at applicant, their spouse, and dependent minor children who live together. The income limit for this program is 100% of the federal poverty line. And then the asset limit, like I mentioned earlier, is $17,500. Age, blind, and disabled. There are some exceptions. So someone might be earning income and think that they're over income for age, blind, and disabled, but in reality, some of their income might be exempt from this calculation. So I've included a list of some of those here. And like Beth mentioned, we'll get these slides out to you later so that you can use them as a resource, because there's no way you're going to memorize all of this information today. But there are some common exceptions that I think should be noted. The biggest one actually that I think people often have questions about is this SSI lump sum. So when someone gets on Social Security benefits, they're often given one big lump sum payment, or sometimes it's divided over 3 dates for Social Security benefits that are owed to them, that to make up for the date between when they filed the application and when they were finally approved for benefits. For SSI benefits, that income is not counted as income for the AABD program. Note that that is not true for Social Security, disability, or retirement benefits. Another one that we often discuss with our clients is this income in kind. So what that means is so let's say I'm living in a house and I owe rent, right? And I have someone who's willing to help me out with that rent. If the person, this third party or whatever, is paying the rent assistance to me so that I can write a check to my landlord, that's going to count as income. If the person pays the landlord directly, that's income in kind and therefore is exempt. So if someone's on a voucher and like your organization perhaps is helping the person pay rent by paying the landlord directly, that does not count as income for the client. I think those are the two that come up most often. There are also some exemptions to the asset limit that are important to note. There's homestead property, so that's the house or that you live in, a vehicle if it's needed for employment, medical transportation, daily essentials, personal effects, and wedding and engagement rings, which can be pricey, I hear. If someone is over the income limit for AABD, and that's age blind and disabled AABD, or if they're over the asset limit, they can spend down their income or assets to become eligible. And then they can still qualify for Medicaid. So this is really wordy because I want to make sure you have all the words. But that's the gist of it. If someone is over income for the program, let's say that's often common, they can spend down the income that they receive on eligible expenses. And once they've spent that down, they can be eligible for Medicaid. There are 2 ways to qualify for spend down. One is a pay-in spend down. So that's it's like you're paying a Medicaid premium every month. So like you pay the Department of Health and Family Services a certain amount, whatever amount you're over income every month, and then you're eligible for Medicaid for that month. The other way is to show that you have medical bills that meet the spend down amount and submit those to the FCRC. That's the local office that's managing the person's DHS benefits. And then once you have enough medical bills, then you've met the spend down and you can be eligible for Medicaid. The bills that can be included are any bills that were received, that they were issued in the last 6 months. But the bills can only be used for spend down once. So if you're accumulating bills over 6 months, that's only going to be able to use in one time. And the bills do not have to be paid to qualify for spend down Medicaid, but Medicaid will not pay those bills as part of, like, once you've gotten on Medicaid, you still are on the hook for those bills. And what to do about those is a separate question. But you'll be on Medicaid moving forward until you get redetermined for it. So some common things that we'll often use to get someone to qualify for spend down are like obviously medical bills that they pay, but also Medicare deductibles. So when someone's in Medicare and they're having the premium for Medicare pulled out of their check every month, those payments can count towards meeting the spend down and can make someone who's otherwise ineligible for Medicaid eligible. And another one that's a little bit less known is the over-the-counter drugs or items. So if someone's paying out of pocket for over-the-counter drugs or items, so that can be anything from like durable equipment like wheelchairs or like braces, that can count towards the Medicaid spend down, but only if it's prescribed by a physician. So they'll need to ask their doctor to actually write a prescription for it. And then when they submit their bills to the FCRC, they're going to need to submit that proof that it was prescribed by a physician in order to meet the spend down amount. Okay, hope that was all clear. So that's aged, blind, and disabled benefits. I'm sorry, hold on, I'm gonna back up. If I can figure out how to do that. Nope, I'm not gonna be able to figure out how to do that. This way, there we go. Let me go back to this real quick. So on this chart, these blue, red, and green, just, those all are for the most part, people get the same benefits under the 3 programs. So it doesn't really matter which program you fit into. There's some detail-y, nuancy stuff that can be different. But you'll get pretty much the same benefits under all 3, including AABD with a spend down. Okay, so moving into what I've referred to as MAGI. MAGI, again, is modified adjusted gross income, which is a weird term to think of when talking about medical access. It's actually a term that comes from tax law, and that is because eligibility for these programs is linked to tax rules. That's just how they were written. And therefore, if you go down to the bottom here where it talks about household, you'll see in all of these groups that the households are actually defined by the tax filing status of the family. So who qualifies as an adult are, for MAGI adults, are adults 18 to 64 years old, and they have to not be receiving Medicare. So if someone is over 64, or if they're 65 or older, or if they are receiving Medicare, they're not eligible under the MAGI program. They'd have to be eligible under the AABD program. That comes into play in a lot in our clients' cases, because as you'll see, the income limit for the MAGI adult is higher. This is 138% of the federal poverty line, whereas the AABD is only 100% of the poverty line. So if someone's 64, they might be qualifying for benefits under this MAGI group, and then they turn 65, and all of a sudden they're over income for Medicaid. And so at that point, we need to figure out if they can qualify for the spend down in order to maintain Medicaid access. Again, that's just the way the rules are written. The citizenship and immigration requirements are the same as it is for AABD. And then again, for the household status, it's based on the tax filing status. So it is not limited to minor children that might be living in the household. So this could include adult children or other people who are living in the household if that person is a tax dependent. If they're a tax family, then they are a family under the MAGI rules. If the person is not filing taxes, it basically reverts back to that, to very similar rules to the AABD. If they're not filing taxes, it's the individual, their spouse, and the minor children who are living with them. But if they're filing taxes, it can be anyone who's included in that tax filing unit. So the income limit is 138% of the poverty line, and there is no asset limit. Children under the MAGI program, again, it's based on the tax filing status, same household definition. It's for children up to 19 years of age, and the income limits are much higher. It's 318% of the federal poverty line. No immigration requirements, no asset limit. Illinois' Medicaid program for children is very generous compared to other states. So that is what that is. And then the third MAGI group is moms and babies. This is for women who are pregnant or up to 12 months postpartum, and then infants under a year old. So under this program, there are no citizenship or immigration requirements. Again, we're based on the tax family, but under this program, the fetus is also considered a family member. So if you look at the income limits, there is no such thing as a 1. You have to have a household of at least 2. And then the income limit is 213% of the federal poverty line. And again, there is no asset limit. Those are the MAGI programs. So this is just a rundown again, so you can compare the income limits against the programs. It's the same income information I had on the previous slides. The income counting rules are very different than in the AABD program I mentioned earlier, because it's based on the tax system. So the adjusted gross income is roughly the adjusted gross income that is included on the person's taxes. Though some income is exempt, such as SSI, also inheritance and gifts, those aren't taxed. And so that's why they continue to not be counted as income under the MAGI rules. There are some types of income, I didn't include them here because they're not very common, I think, to the clients that you all would serve. But there are some types of income that get added back in that are untaxed. They can also get income deductions. These are, again, deductions that you would get on your taxes. Those deductions still are deducted from your income before determining eligibility, even if you don't file taxes. So we frequently will get clients in who don't file taxes because their income is too low. And so we need to figure out approximately what their adjusted gross income is before we can determine if they'd be eligible for the MAGI Medicaid programs. But okay, that's probably more detail than you need to know. If you look at the income limits, it's going to be roughly correct for all your clients. I don't want to like overwhelm you, but when we look at it, because we're looking at usually the ones that are getting denied, we'll look through all this stuff. Okay, so the third group, the way that I've grouped them on here are benefits for non-citizens. So the first is Medicaid medical benefits for non-citizen victims of trafficking, abuse, and other serious crimes. Unlike the other medical programs that I mentioned earlier, this is a fully state-funded program, subject only to Illinois state rules. So to be eligible for this program, the DHS must first determine that the person is ineligible for the federal programs, because in the federal programs, the federal government is pitching in some of the money. If they're ineligible for the federal programs, then they're going to look to see if they're eligible for the state-funded program. To qualify, someone must be either preparing to apply for or has already applied for asylum or T visa. Once they get the asylum or T visa, then they're going to meet the immigration requirements for the other programs. And so that's why this program doesn't cover people who have asylum or T visa. The other group that qualifies is someone who is preparing to apply for, has applied for, or has received a U visa. If they've received a U visa, they'll continue meeting the immigration requirements for this program until they qualify for the federal benefits. So there might be some legal permanent residents for those of you who do the immigration work. There might be some legal permanent residents who have gotten their permanent residency status because they got the U visa. They don't have to do the 5-year waiting period before they get any medical benefits. They'll continue to qualify for Illinois VTTC medical benefits until they've met the 5-year waiting period for the federal benefits. That makes sense. This program mirrors the AABD cash rules in terms of household composition, income limits, and asset limits. So those are just taken from the same rules that I started off with, the AABD rules. They're here. That's VTTC. Other immigrants potentially could qualify for other state-funded medical benefits. One program that the state has is for immigrants who don't meet immigration requirements of any of the other programs who are at least 65 years old. This program, again, mirrors the AABD rules in terms of household composition, income, and asset limits. However, this program is currently paused for enrollment. That means if someone is already receiving benefits under this program, they will continue the eligibility for medical benefits until they stop getting them, either because they don't qualify or if they fail to submit their redetermination. And so if you're working with any immigrant seniors who are getting medical benefits for this program, it's really important that they submit their redeterminations once they're up for redetermination, or else they might lose their benefits and not be able to get back in. And we don't know how long this pause is going to last. There is also a program for immigrant adults who are 42 to 64 who don't meet the immigration requirements for the federally funded, the joint federal state Medicaid programs. This mirrors the MAGI adult rules in terms of income limits, asset limits, and household composition. Oops, sorry, I should remove that. That's wrong. Beth, can you make a note that I need to remove that before I bring this to before I send it out again? But it's the tax filing family is put together. Again, this program is paused. So if there's anyone who's currently receiving medical benefits under this program, as long as they keep submitting their redeterminations, and as long as they otherwise remain eligible, they should continue Medicaid coverage. But there are no new enrollments. And if someone fails to submit a redetermination, then they might not be able to get back in. Okay. Go this way. I have this chart just to make it easier for you to see the different categories. We don't need to discuss it. This is for you to use later if that's helpful. Okay. So with Medicaid redeterminations restarting, what can you do to help you or your clients keep your Medicaid? When someone is up for redetermination, the state has to send a notice letting them know what's going on. That includes if their Medicaid's continuing or if they have a redetermination that's due. And so ensuring that the client actually gets that communication from the state is key to ensure that they don't miss the deadline for submitting the redetermination. So the one point is to help make sure that they get the notices by making sure DHS has the updated address. They can sign up for text messaging where they should get text reminders that a redetermination is due. And then make sure clients know to open and read all the mail that comes in. I've had a lot of clients where they they get mail, and if it's not something that they're excited about, they kind of throw it in a pile and they're like, I'll look at it later. But there are very, very tight deadlines on responding to these redetermination notices and a lot of other notices from the Department of Human Services. And so they really need to, if they get something from DHS, they need to open it and read it right away to make sure that it's not something they need to respond to immediately. Once they open it, the key to knowing if it's something they might need to act on quickly is by looking at the top of the notice. There's going to be something in bold in the center. And if it says notice of decision, interview, verification checklist, or redetermination application, that's going to have a deadline. And so that means that they need to look at it and see if there's something that they need to do. And then also if you can review with your clients to make sure that they have proof of assets and income ready. These deadlines are really tight. And so sometimes it takes a while to get the documentation that the department's going to need. So reminding clients to keep copies of paycheck stubs so that if Department of Human Services asks for it, they have it right there and can turn it in, rather than having to figure out how to get copies of of paycheck stubs that they might have tossed or they don't know where they've put them. Okay. So here are some ways to update your address and to make sure DHS has the correct address for you. So one way is to go to the local FCRC and just let them know, tell them to make sure they've updated your address in the system. Another way is to call the DHS helpline. The number's right there. And then for Medicaid only, the state has set up a website where they can change their address online. And then Manage My Case. We live in Manage My Case. This is a great system because if you put things in here, you can have a record of what happened and you can go in and double check to make sure that it happened. I've had clients where they've gone to the local FCRC or they've called the DHS helpline to try to update their address or other information, and it just didn't go through, or there was a typing error, and they called and the person just made an innocent mistake, but then put the wrong address into the system. And so I like to use the online system because we can look and make sure that it is correct. And so the way to access it is to go to this website, and then this screenshot on the side here. I don't know if you can see my arrow with this cute little girl. If you click on Manage My Case, it will sometimes go to it'll go to one of these two screens. If it goes to this middle screen where it has the like case number, case status, approved, terminated, it's not totally intuitive, but what you do to get into the system to actually see the case is by clicking on where it says click here to report changes. You might have more than one case, like in this example. I usually start with the one that says approved and see if there's anything in there. Sometimes there'll be more than one's approved, so it might take some clicking around and going back and forth to figure out which case number is the one that you need to be working in. Eventually, you'll get to this screen on the left. If you click on this tabs, there's these tabs at the top. So case summary, benefit details, contact information, account management. If you click on the contact information tab, and then click on report a change, that's where you can report the address change. Another way to ensure, like I mentioned, that you're getting notices or to sign up for text alerts. So the person should get a text. If they're signed up for text alerts, they should get a text telling them that something is due, or that they have, I think it's supposed to do for interviews too, that they have an interview if one is needed. So again, you just go into ABE and then click on the account management tab, and then go to manage my communication preferences page. That will bring you to the screen on the right where the person can put in their information. One little note though, there are scams happening, numerous scams being perpetrated on low-income people, which is horrifying. It's happening a lot right now though. And so sometimes people might get messages that appear to come from the Department of Human Services asking to like verify personal information over text. The department will never ask for a response like that to a text. So if a client is getting text messages, it should just tell them that they need to do something, but it will not ask them to respond with personal information. And so if they get a text like that, they should report it to the department so that they can look into it. Okay, so how to find notices and deadlines. Like I said, redeterminations are happening in various months, and there's been a lot of confusion for folks about when their redetermination is actually due. Because if you fill out a redetermination notice before it's due, it doesn't count. You have to do it when it's due. And so one way to do it is by calling this phone number, and then this is to check the RIN. The RIN is, I'll show you in a little bit where you can find one. And then you input the RIN, which is like basically their Medicaid ID number, and it'll verify that it'll tell you what months they're eligible for Medicaid. Again, you could go into Manage My Case and check, or and you can look at notices. We'll get to that in a second. So here's what it looks like in Manage My Case. You'd click on the Benefits Details tab at the top, and then click here for more details where you see the person's name. Under this who, it's going to have names listed. That will bring you to the screen on the right. And as you can see here, it says your next Medicaid determination must be completed by March 2024. So it'll tell you the date that the Medicaid redetermination is due. It'll also have information about the MCO, the managed care plan, if they have one, which can be pretty handy. To find the notices, oh, I didn't put how to get here, but there's on that main homepage for Manage My Case, if you click down, it's kind of hard to see. There's a little link that says see notices. It'll bring you to a page like this. And you can see where the notice of decision is. It'll be listed on the notice name. If you click on a notice of decision, you might get something like this. You might have to click around to find the one that approved Medicaid, because it'll have all of their DHS benefits in there. But you'll see, okay, it doesn't look exactly like this because it didn't fit on a page. So these little blue lines are like where I cut parts of the notice out. But this notice has important information like the date of the notice, which is important for knowing if you need to file an appeal, figuring out what the appeal deadline is. It'll also list every household member who's getting benefits, and it will have that RIN number. So if they don't have a copy of their medical card, and they need to find their RIN, it should be on the notice. And it will say if the person has Medicaid in a certain month. It doesn't say when the redetermination is due, but you might be able to kind of guess, like it looks like Medicaid started on this date, and so it should be about 12 months later, but it's not going to be definitive. So it's a starting place, but it won't give you the answer. Okay, so submitting the redetermination, there's a variety of methods that you can use to submit the redetermination. In the materials that we're sending out, I included samples of the redetermination notice, as well as a copy of what it looks like when you've submitted the redetermination through Manage My Case on ABE. I'm not going to look at those in this training, but I wanted you to see what kind of questions are asked so you can know, just kind of being prepared if you haven't done one of these before. It's much easier than the application. So it's mostly just confirming information. So we recommend, if you can, to file redeterminations online. That's nice because you have proof that you filed it. And these are basically in order of like best proof that you filed it. The department is having to handle a huge amount of these cases right now. And so it's not common, but it has happened where we've filed applications either in person or by phone, and the department doesn't have any record that we did it. And so it's better to file it either online or fax, or you can mail it to this address in Springfield with a return receipt so that you have proof that you filed it, and also proof that it should have been received. If Medicaid is terminated, there are some options. So the first step is to look at the note. They should get a notice in the mail that says that their Medicaid was terminated, and it will say why the benefits were terminated. So the first thing to do is look at the notice and see if you can figure out why the benefits were terminated. The most common reasons are that we've seen are that the redetermination wasn't submitted, or that the person DHS thinks the person is not financially eligible anymore. If you think DHS was wrong, you have two options. One is to appeal the decision, and the other is to file a new application. The benefits of filing an appeal are that you can get a full reversal back to the date of when the benefits were cut off. Depending on the situation, that doesn't matter though, because when you file a new application for benefits, you can get up to 3 months of retroactive coverage. And so honestly, that's mostly what we've been doing in our office. If we see someone's benefits are terminated, if they don't need medical coverage immediately, if they can wait a little bit, then we'll just file a new application, request the retroactive coverage, and it's a faster process in most situations than filing an appeal. But in some situations, you will want to file an appeal because they can get ongoing Medicaid benefits while their appeal is pending. You have to request it on the application, on the appeal. You have to say, I want to continue receiving benefits. But the time frame for doing an appeal can be anywhere from 10 days to several months. And there's really no way to tell on the front end how long that's actually going to take. The deadline for filing an appeal is 60 days after that date on the notice. If DHS's decision was actually correct, so if they say you failed to submit your redetermination, and in fact, DHS sent you a redetermination notice and you got it and you just didn't do it, then the only option is to file a new application. And then you can request 3 months of retroactive coverage, and that might make you whole. Okay. That's the beef of things. I don't know, do we have questions, Beth?
We do have a couple of questions. I did want to just pass the mic over to David for a moment so he could have just a time to chat. Let me mute you, David. Give me a moment.
I'm sure so that
Okay. Do. Okay, David, you should be unmuted now.
Hi, Beth. Thank you. Can you all hear
Good
me?
morning.
Good morning.
Yeah.
Yeah. So thank you. I just wanted to take a brief moment. I'm sorry I was late, so I wasn't able to do it before. But I just wanted to introduce you. My name's David Esposito. I'm the executive director for the Supportive Housing Providers Association. So SHPA, as the host of the Illinois Homeless Community Education and Technical Assistance Center through the Illinois Office to Prevent and End Homelessness, we just wanted to thank Legal Aid Chicago, Beth and Gwen, for doing for their partnership in providing this training. And then, of course, if you'd just like to learn more about SHPA and the Illinois Homeless Community Education and Technical Assistance Center, you can visit our website or you can contact me. But it was I'm so glad to see so many people on this training series today. So thank you all for participating. And like I said, if you'd just like to learn more about who we are and what we do, just please reach out to myself or visit our website, and we're happy to talk to any one of you. So thank you so much, Beth, and thank you, Gwen. So let's get back to your questions, because that's more important.
Thanks,
Awesome.
David.
Thank you, David. Again, you in the Office for Preventing and Ending Homelessness in Illinois, letting us be able to do this training in the first place. Let's get to some questions. I know we had a couple of good ones here just to start with. Just so you know, the training is recorded and it will be available later. It's going to be hosted on the SHPA training website. We will provide more details about that once we've completed the training today. Same with the PowerPoint slides. I will send those in an email afterwards. All right, so the first question I have, and this is a very interesting one and sort of timely question. What about migrants from Venezuela? Are they eligible for Medicaid benefits?
Yes. So I actually, hold on. I'm going to take these out of order. Let's see if I'm adept enough here, because I looked at some of the questions from the pre-hearing survey. So for the immigrants who are coming, the new arrivals who are coming to Illinois, they might qualify for benefits. It depends. The ones who are planning to apply for asylum or a U visa could qualify for Medicaid under the VTTC program. I want to know, there's some realities under VTTC. So this is, let me go back. So this is this one. So if they're planning to apply for or have applied for a U visa or asylum, they'll meet because they're not going to be eligible for the federal Medicaid programs. So, but they'll meet the immigration requirements for this program as long as they're within the income and asset limits listed here. Oops. The VTTC program right now is, how do we put it? It's taking a long time to get applications processed. And the application process for these is a little bit more complicated. If you are working with a lot of people who need to access medical benefits under this program, feel free to reach out to me, because I can send you kind of the forms and the more information about the extra requirements for proving eligibility under this program. It is taking several months to get benefits. There's just that they're receiving so many applications, and there's a limited number of Department of Human Services staff who can process them. Sorry, here we go. So another option is while they're waiting for their decision on their VTTC application, there are federally qualified health centers in various places around the state. And so I included a link here, findahealthcenter.hrsa.gov, where you can find a federally qualified health center near you to get medical care until that Medicaid is, or the VTTC medical benefits are processed. Should I go ahead and go through the slides on here, or should I?
Yeah, there's a couple of other questions. One of the questions is, how would an individual who is homeless go about applying for Medicaid? If they do not have a mailing address, is there a way for them to apply for and receive benefits?
Yeah, most of the folks who we serve who are homeless use the FCRC address. So that's the like local DHS office where they go in person and apply for benefits, or, you know, it's where the staff are working. You can use that address as your address to apply, and then they'll just hold everything there. So it's harder because the person has to go into the office to get their stuff. There are some added benefits, though, to using that address, because then DHS will know that the person is homeless, and it won't affect anything under the Medicaid program, but there are some special provisions under SNAP law in particular that DHS is more likely to apply those special provisions if they know that the person is homeless.
Yeah, and you don't have to prove proof of residence if you're like an Illinois resident who's homeless. So
Right.
that is also a barrier that's kind of lifted. We do work with homeless folks a lot, and we have great success working with the FCRC, the local DHS office. It might take some advocacy on your behalf, or perhaps reaching out to your local legal aid to get some support on that issue, but it's an excellent way of making sure folks can still safely receive their DHS mail, making sure it's not going to a shelter and old address. Also, you're able to have a new link card printed on the spot because, of course, there's nowhere to mail it to. So it does come with some perks, along with, of course, some drawbacks of not being able to always access it, blah, blah, blah. But we have MMC too, so folks can kind of check on where their benefits are at.
That's Manage My Case, yeah.
And Manage My Case, MMC, sorry. We live in a world of acronyms. It's obnoxious. Next question here. Can someone claim they never received a letter to avoid having to reapply? For example, if they forgot to notify DHS of their change of address.
If they forgot to notify the change of address, then they're just gonna have to reapply. In some situations, if they did notify DHS of the change of address and it wasn't put into the system, they can contact. I mean, we've actually had a lot of success if someone's benefits were cut off and it was obviously an error on DHS's part. Just call the FCRC or go into the FCRC and discuss it with the staff. They're often able to fix things on the spot if the error was obvious. And so you can try that. But if they did not report the change of address, they're going to have to reapply.
Okay. And another question here, which is kind of related, in my opinion. So I'm going to go with this one next. If someone's income increases to where they are no longer eligible for Medicaid, how long after their income increases will their Medicaid terminate?
Right now, it'll be whenever the redetermination is. There are electronic checks that the computer system does occasionally, and I honestly don't know the details of that. Sorry. For like, they should, so for folks who have not been redetermined yet, they should remain on benefits until their redetermination happens. If they're outside of this protection period that happened because of the pandemic, it might happen sooner, but they will get a notice. DHS has to send them a notice before they're terminated saying that you will be terminated at some point in the future, because they have to give the person the right. Like, they can't just look in their computer system and say, oh, this person's income increased, and then just cut them off. That's a violation of federal due process laws. And so they will have to, they'll get a notice that'll give them a little bit of time before the benefits will terminate. Oh, you're muted, Beth.
After all these years of being online in the pandemic. All right, this next question is a bit more complicated, and I encourage the person who posted it to reach out for like more clarity. But I wanted to give Gwen the chance just to respond at least. I'm working with an individual who is legally blind, married, and has a toddler son. She lost her Medicaid benefits due to her husband's income. Does she have any recourse? Adding that her and her son to her husband's insurance through work would be a financial hardship.
We'd have to look at it. I doubt it. I mean, if they're really over income because of her husband's income, there's probably not anything to do. What they should do in that situation is apply for marketplace insurance, which might be cheaper. And I have here, because this was one of the questions that was submitted online. Wow, is that big? Okay, if a person is not eligible due to income, is there someone at DHS who will help them apply for the marketplace insurance? I actually don't know the answer to that one, and maybe there's someone on here who does. But I put the link in here to through healthcare.gov for how to find a local person. You have the option to get an assister or a broker. And I highly recommend that if you go through this website, you go with an assister, not a broker, because the brokers are associated with certain insurance plans. And so the assisters are more there to help you figure out what your needs are and then just find a match. They don't have an incentive to try to push you into one plan or another. I'm not saying all the brokers would, but it just, without knowing them, it just feels better to go with someone who's an assister rather than a broker.
We are at midday. Do we have time for one more, or should we end it?
I'm good if you want to, and I've got
For
some
folks-
stuff in here prepped, so.
Okay, cool. So for folks who are able to stay around, this is still going to be recorded, so you can return to it later once we provided access to it. This next question, does client need to inform DHS of increase in income if it's 6 months before the redetermination date? Do they only look at 30 days of income, and after approval, are they free to earn above income limits and then decrease income 30 days prior to redetermination?
You're supposed to report increased income, I believe, within 10 days. I have to look up the exact timeline. And so they should be reporting it once it happens, and then DHS will then issue a notice saying your Medicaid will be cut off sometime in the future because of your increased income, and you have the right to appeal that decision. Does that answer the question?
I believe so, yeah. I think reporting requirements are always important when it comes to changes of income or changes of expenses. So it's always important to report those to DHS. These are probably the questions from the Q&A. If you wanted to go ahead and finish out the information that you had, Gwen.
Yeah, let me get over here because one of these is kind of long. One of the questions someone submitted is, does Medicaid pay for your Medicare premiums? And the answer roughly is no. Well, the answer roughly is yes. Okay, so it is Medicaid that ends up paying for it, but it's actually a separate program. Under Illinois law, if you apply for any program, you're supposed to be assessed for all of them, but with a wider range of exceptions. And so we really highly recommend that if someone is on Medicare, that they go ahead and apply specifically for what's called the Medicare Savings Program. So on ABE, that is this one at the bottom, apply for Medicare Savings Program. So if they're applying for Medicaid, they're going to click yes to apply for healthcare coverage and apply for Medicare Savings Program. I honestly, we recommend across the board that unless someone really doesn't want something, that they apply for everything. Just click yes all the way down. Because then they'll make sure that they're getting all the benefits that they qualify for. The Medicare Savings Program has a few different programs. I left the acronyms out of here. But roughly there's two kind of big categories. If someone's income, and I put them in backwards here. So if someone is earning under 100% of the federal poverty line, they'll qualify for a Medicare Savings Program that covers their Part B premiums, their Part A premiums, if they have any, as well as deductibles, copays, and a lot of other out-of-pocket costs. There are a ton of legal protections in this program to ensure that people can access medical care. So doctors aren't allowed to balance bill, for example, for people in this program. If someone is earning between 100 and 135% of the federal poverty line, then the Medicare Savings Program will only pay for their Part B premiums. So there aren't as many protections. And if they have to pay for Part A, they will continue having to pay for Part A. The benefit of this Part B only group is that you can also request 3 months of retroactive coverage. So if they've been paying Medicare premiums for a while, they can apply, like if they apply today, let's do math. So today, November, October, September, August, August. They'd be able to get their premiums reimbursed all the way back to August. And then what happens is that Medicare becomes the primary person who when you go to the doctor, they're going to bill Medicare first, and then they're going to bill Medicaid. So just as a reminder, this is from the last training. Someone can qualify for Medicare if they're 65 years or older, if they're receiving Social Security disability after a 2-year waiting period, or if they have end-stage renal disease or ALS. If they qualify for Medicare and they qualify for Medicaid, so these are these income limits for the AABD. As a reminder from earlier, there's all those Medicaid programs, but if you're getting Medicare, you have to qualify for the one that has the 100% federal poverty line limit, possibly with a spend down. It can get kind of fun. But if they qualify for both, then they can also get into what's called this Medicare Alignment Initiative. So I literally copy pasted from DHS's website some information about that here, so you can have it. And I put a link to the website that I got this from. And that's all I have about that. I talked about this one. Oh, someone asked what other benefits would a Medicaid participant be eligible for? I can't say specifically any one. So this is all the Department of Human Services programs. Again, I encourage people to apply for all of them. We're still learning about how people get into the Medicaid program through various ways, but our understanding is that there are certain applications that they submit, particularly if they're applying for Medicaid through a Medicaid provider, that they can't apply for all programs when they submit that application. And so if you're one of those people who's helping with one of those kinds of applications, just, encourage them to go apply for the other programs too. I also add in here WIC. So if you're working with women who are pregnant or who have children, I think under 5, they can qualify for food assistance through the Department of Human Services. We don't help with those applications, so I don't have a ton of information. I was, just to be transparent, I used WIC though when I had my kids. And so it was a great program. I mean, it helped a lot with being able to provide food for our family. And so, but you do have to, it's kind of arduous. You have to go in person, and there's a lot of kind of hoops to go through. But there's a lot of services that are provided at those places as well. And so that website for how to apply is right there. I did not get WIC in Illinois. It was in Louisiana, but still good.
Still helpful in any state.
That was it. Those are the ones that I saw online.
All right, awesome. So we're at 12:07. Thank you so much to everyone for joining us on this public benefits journey. We are 2 sessions into a 12-session sort of training program with SHPA. So we look forward to our next session with you folks, which will be in January on the 3rd Tuesday of the month. But I will send out more details on that, and further trainings will be on the 3rd Monday of each month. So I will be sure to send that information out. We'll be sending a post-training survey. Please do respond if you do have the time to do that. We try really hard to make these trainings useful to you and respond to questions that you might have actively. Saying that, if you have any more questions, please do reach out to Gwen or myself if it's a public benefits related question, and we can certainly send you in the right direction if we can't help you. Other than that, PowerPoint slides will also be sent. Look out for a video link from SHPA. And other than that, I wish you a slightly warmer and happier day than this morning started. Take care, everyone, and we will see you very soon.
Thanks, everybody.